Today we have the pleasure of being with not just an oral surgeon, but an oral surgeon that has a specialty in oncology. And he also does implants. We're going to talk a little bit about that. Doctor, how you doing?
Hello. Hello, how are you all?
It's such a beautiful day, huh?
Yes, of course. It's a sunny day in Costa Rica, in La Ribera, in Costa Rica. So
good. Doctor, tell me a little bit about yourself, what you do. I understand you also work in the public sector too, right?
Yes, I am a surgeon of the San Juan de Dios Hospital. That is the first, the main hospital of the country. So
it's a level 3 hospital.
It's a level 3 trauma and a level 3 hospital. So we have all the specialties, and I am the chief of clinic, the maxillofacial unit in that hospital. So I'm full dedicated in all about facial trauma and all about facial deformities. It's a wide spectrum of procedures, cleft lip palate, facial syndromes, head and neck oncology, facial reconstructive procedures. So it's a busy unit.
So Doc, so those of you that don't know what San Juan de Dios, the hospital, it's a public hospital that is actually a level 3. And when I say level 3, there's different levels in Costa Rica. There's level 1, level 2, and level 3. Most of the time, level 2 and 3 is what you're going to see on the higher end. And he actually works on a higher end, but he also has a private sector.
Yes, we are right now in one of my private settings that is here in La Ribera, where I usually see the patients and do the oral surgery procedures. And I usually see the patients for the first time and try to do the diagnosis and the treatment plan. And some of them can be operated here, but if the patient wants to have the surgeries under sedation or general anesthesia, we can go to the actual OR to do these procedures under all the safety of the sedation and general anesthesia.
So Doc, we talked a little bit briefly about safety. Safety for you is a little bit different because although you're working in the private sector and you're in the public sector, you're in the OR a little bit more than most oral surgeons, correct?
Yes, I take safety as one of my major aspects that I pay attention. For me, I'm used to go to the OR pretty frequently. I usually do about 4 or 5 major surgeries a week, and I've been doing that for the last 13 years. So I take safety very seriously. I'm used to request all the lab work, or if the patient needs more than that, for example, EKG or a special test or CT scans. I'm used to do that. It's something that is just part of my life. I do it in the hospital, but I also do it here in my private clinic. I can tell you that I have a broad spectrum of procedures that I offer here in my private practice. Oral surgery, dental implants, but also orthodontic surgery for people that have some facial deformities or that they need some improvement that can be done by surgery. And also all about head and neck oncology. That is a different world that I have a fellowship. Yes. So
you did a fellowship. What part of the U.S.?
Well, I did a fellowship at the University of Maryland. It was a formal fellowship from the University of Maryland, a great place, a great university, I spent a whole year, and it is known as one of the best places to do head and neck oncology in America. And well, I had the chance to be trained in all the aspects of the surgical treatment and of the cancer patients with head and neck tumors, and also including the reconstructive procedures of those patients, because when you treat head and neck cancer patients, you also need to think about the reconstruction. Right, yeah. Yes, you cannot take part of the lip, part of the tongue, part of the cheek, or have the mandible, or anything that is required, without thinking how to reconstruct, how to rebuild all these tissues and restore the function and the aesthetics of those patients.
So when you're operating, you're not just thinking about taking the cancer out, you're also thinking about how it's going to be reconstructed at a later point.
Yes, yes, of course, and that can be done by moving local tissues, using the local tissues. Just you need to move them to improve the aesthetics, or you can use some parts of the rest of your body to rebuild. For example, if the patient needs to get a tongue surgery or mandible surgery, we use different parts of our body to transfer those tissues and restore the face, restore the function of the mouth and the tongue, the capacity of chewing and also to speak correctly. So all these procedures are very complex surgeries, including the microvascular reconstruction, including free flaps, including all these about reconstructive procedures of the face, mouth, and as I said, it is part of the cancer treatments. And also all these procedures can be done also for improving quality of lives of some other patients that are not cancer patients. For example, if a patient was born with a facial deformity, well, I have many other procedures available to restore, to improve their quality of lives, the way they look. So
do you think you can get them to like Brad Pitt status?
I mean,
well, we can't do miracles, right? We can't do miracles.
For sure, all these situations can be improved. For example, I told you I have experience with patients with cleft lip palate, or what it's called craniofacial syndromes. There are patients that were born with facial deformities, and I do 2-3 surgeries on them, sometimes just one, and I can restore the position of the bones of the face, and also with that the patient looks totally different, improved, symmetric, and also maybe with a little detail at the end. Can be, for example, just adding a little fat in different parts, or removing some fat from other parts, just to create a symmetric face. So that's what I have the ability to offer to my patients. So,
well, Doc, thank you for taking the time to listen to us, to share about what you do here. Those of you thinking about doing real surgery, real extensive, and then it may involve removing cancer and different things, that this particular physician not only has the experience in that particular area, but has the capacity to resolve. Because something that a lot of people don't know, doctor, about physicians here in Costa Rica is that when you guys actually go into medicine, your second year, you start already seeing patients, unlike sometimes in the US that they see patients their third year. So you have a little bit of an advantage, but also too is that you're involved in the public system for a period of time before you really can go out into the world. And I feel that it's an advantage to be pushed into the public system where you see everything that could happen and gives you that much more experience.
Well, that's something that I really like, and I like to speak loudly to offer to my patients that I see that the most important thing that a physician can offer is the experience. And you don't get this experience just by reading or by doing a specialty or even a fellowship. You need to be involved in those cases every single week. You need to be a surgeon that operates every single day, every single week. And with that experience, you would offer also to the private setting, to the private patients, the same experience that you get from the public system. So yes, we have the experience, and also, well, we have a kind treat to our patients, and this is a beautiful place. We have a great facilities to offer, as I said, with you can be operated awake, you can be operated under sedation, under general anesthesia. We have many services to offer. So,
well, Doc, thank you very much for taking the time for all this to happen, because a lot of people don't know how the great service we have here in Costa Rica.
Okay, well, nice for the interview, and see you then.
So you guys thinking about the surgery, think about when you're getting a physician, whether you use somebody that we recommend or the physician that you see here in front of you, do your homework, make sure that there's experience, that there's education, but also the experience on doing what your procedure. Pura vida, and always be safe.